1. X-ray procedure. When a patient presents with symptoms suggestive of a fracture, a medical professional, such as a doctor or a radiologic technologist, will perform an X-ray examination. The patient is positioned between the X-ray machine and an X-ray detector, typically a digital sensor or X-ray film. The X-ray machine emits a controlled dose of X-ray radiation, which passes through the body and strikes the detector. 2. Absorption of X-rays. When X-rays pass through the body, they are absorbed at different rates depending on the density of the tissues they encounter. Bones are denser and absorb more X-rays, while soft tissues like muscles and organs allow more X-rays to pass through. 3. Fracture detection. Fractures in bones cause interruptions or changes in the normal structure of the bone. When X-rays pass through the fractured bone, the X-ray detector records areas where the X-rays are absorbed more or less than the surrounding tissues. 4. X-ray images. The X-ray machine creates images known as radiographs, which show the variations in X-ray absorption throughout the bone. On the radiograph, fractures are visualized as dark lines or gaps in the bone, representing the areas where fewer X-rays have passed through due to the bone's disruption. 5. Types of fractures. X-rays can identify various types of fractures, such as simple fractures, compound fractures, where the bone protrudes through the skin, and comminuted fractures, where the bone shatters into multiple fragments. They can also show the alignment of the fractured bone ends, which is crucial for assessing the severity of the fracture and planning appropriate treatment. 6. Comparison with normal side. In some cases, X-rays of the uninjured side of the body may be taken for comparison with the injured side. This helps to identify subtle fractures or to determine if a fracture is old or new. X-rays are a quick and valuable tool for diagnosing fractures, allowing medical professionals to assess the location, type, and severity of the fracture. This information guides appropriate treatment decisions, such as casting, splinting, or surgery, to promote proper healing and recovery for the patient. It's important to note that X-rays are just one part of the diagnostic process, and additional imaging or clinical evaluation may be necessary for a comprehensive assessment of the patient's condition.